Hi, this is Dr. Jonas Leibowitz of My Diabetes Doc, here to talk to you about what is diabetes. So why don't we talk about the phrase diabetes mellitus? That's what we call diabetes. Now the lingo of diabetes, it really comes from ancient Greek and Latin basis, where diabetes kind of means to pass through or to siphon. And mellitus, sometimes first pronounced mellitus, but mellitus as well, usually refers to sweet or honey-like or syrupy-like. And essentially, the word diabetes mellitus means sweet urine. Really, that's how it was diagnosed years ago. Some early descriptions of diabetes go back over 3,000 years ago. And all of the ancient civilizations, both Western and Eastern, had described diabetes in the population. And back then, when there were no blood tests and there was no scanning, sometimes the healthcare practitioners of that era would diagnose patients based on knowing what the urine tastes like. So that's the word diabetes mellitus. Now in our population, the most common diagnosis of diabetes is that of type 2 diabetes, and that's what I'll focus on now. So again, diabetes mellitus is what we call it. There are different types, and we'll talk about type 2 diabetes. Type 2 diabetes is a chronic disease. It's very common, and in the United States, more than 10% of the population has it. Many more Americans are at high risk of getting diabetes and have an elevated sugar that doesn't yet meet the criteria of being called a diabetic at this time. Now, when we think about how did we get here, that so many people have diabetes, how did this happen? I think the easiest way to think about it is think about a car filling up its gas tank with gasoline. We as humans eat food, we drink, and a lot of our food comes from sugar or glucose. Carbohydrates are a form of sugar. And as we take in that food and we take in that drink, we have to store it somewhere. And we store it in our body. And imagine that we're storing sugar in our body, in the liver, in the muscles, in the fat cells, and it's going into all these places, but somehow we don't need to store it anymore. Maybe we filled up our storage tanks. Maybe the key hormone that helps you store sugar, which is insulin, isn't working as well. Maybe you don't make enough insulin. And for all these different factors, you may not store sugar well enough, and therefore the sugar levels are higher in the bloodstream. And when it reaches a certain level, we'll call that diabetes. Now, there are some risk factors for diabetes, and there's a family history, especially among first-degree relatives. If you're overweight, if you already have other metabolic conditions like blood pressure or cholesterol, you're prone to it. If you're less active, you're prone to it. If you're a woman who had gestational or pregnancy diabetes, you're prone to it. Also, if you're a woman who had polycystic ovarian syndrome, you're prone to it. So there are certain conditions that occur in the population that makes one more likely to get diabetes. When we talk about the symptoms of it, well, really people with diabetes don't necessarily feel sick. There's a group of symptoms that people have when their sugar is pretty high. They're going to the bathroom a lot because their body's trying to get sugar out of the body and defend the body from these high levels of sugar. They may also be very thirsty because after you lose a lot of urine, you got to drink to make up for the water. There may be blurry vision as well. There could be general fatigue. There could be wounds that don't heal. So these symptoms are more related to the very high sugar. The issues with diabetes are really the long-term complications. And we divide them up into those that affect the large blood vessels, heart attacks, strokes, clogging of the arteries to the lower extremities, to the legs, to the feet that could lead to wounds, as well as issues with the smaller blood vessels, eye damage, kidney damage, and foot and nerve damage. So those are the major complications. And in our population, those complications really lead to a lot of death and disability, and therefore you can see how serious diabetes is. So if you start to understand what causes diabetes and what are the risk factors, you can start to take action. Now, the last question I want to leave in this short video is how did we get here? So how did we go from a population that didn't have diabetes to a population that is flooded with diabetes and to a world that's being flooded with diabetes? And it's very interesting. We as human beings needed to survive in this earth. We need food, we need shelter, and we need to have energy to do the activities of the day. So again, if you think of your diabetes as this is a disorder of how I store my energy, I'm not putting that sugar away into the tank so I have it to use in the future, but it sits in my bloodstream at very high levels. We got diabetes because we don't do as much. We got diabetes because food is readily available. We can order it all hours of the day, all hours of the night. We can cook quickly. We can have things delivered to us. And because of that, food is accessible. Food tends to be heavier, more fat, more calories, because our brain likes that. Tastes better, and our brain also likes the fact that we're storing more energy. So our brain is thinking about the bad stuff. It's thinking about thousands of years of droughts and famine and wars and migration and all the kind of things that make us know we need to store that food or else we're not going to survive. And our brain remembers all that. And with food being readily available, the activity that we need to do to get the food, very few of us are hunters or planters or have a whole yard full of food. Most of us get our food made for us or prepared for us, or we buy it. So we don't live that way anymore. As well, our jobs are sedentary. We tend to work at screens, at phones, at computers. We also tend to be alert and awake at all hours of the day and the night. So all the hormones that kind of tell us to go, to get moving, to get energy is on the go around the clock. So in summary, we wanted to go over what is type 2 diabetes based on the how we get it, what the risk factors are, what the complications could be of diabetes, and later we'll go over the absolute criteria. What are the numbers that define diabetes so you know where that goes next.